Hey everyone! As you know, I've affiliated with MDVIP and will be offering a new women's health program which will expand on your gynecological health and allow me to address many of your primary care needs. This video just gives you a brief snapshot of this new practice, and I appreciate you taking just a few minutes to learn more about this. Please know that after you watch the video, I'm available to personally talk with you one-on-one and answer any questions that you might have as to how we can best serve you. You know, when I went into medicine, I was taught that in order to treat the whole person, you should know everything about the patient. And this requires one thing, and that's time. Unfortunately, in a traditional medical model, you don't always have enough time to address the healthcare concerns beyond just the immediate needs, or even look at issues that fall outside of the normal gynecological health. To really meet your needs, it's important for me to know more about your overall health to help make sure your evolving needs as a woman continue to be met. Simply put, you need and deserve more time and attention regarding your health and the peace of mind that someone is always in your corner, regardless of government or insurance changes. Let me give you some very tangible examples. A typical GYN practice today may have 2,500 to 3,000 patients. That means they're seeing on average between 25 and 35 patients a day. Now, 80% of those visits are generally focused on women of childbearing age, and 30% of your doctor's time is usually spent on the obstetrics aspect of it at the hospital. Quite honestly, that's why you end up waiting for several hours. Now, while I no longer deliver babies, this has given me the opportunity to spend more quality time with you and to be able to pay more attention to significant areas of your health like nutrition and fitness, sleep hygiene, hormones, sexual health, and even emotional well-being. And I want to focus on prevention and map out a plan for you to achieve your goals so that you can enjoy a healthy, active lifestyle that you really deserve. In my MDVIP affiliated practice, I've reduced my practice size from 3,000 folks down to 300. Doing this will give you the time and attention you need to expand on your gynecological health as well as address many of your primary care needs. Visits will start on time and they won't be rushed. You can make same day or next day appointments for any issues that you have, and you'll be able to contact me after hours on my cell phone for any urgent needs. Now, during office hours, you'll actually talk to a real live person, and you can securely message me and my staff 24 hours, 7 days a week. If you happen to have a medical issue while traveling, you'll be able to call me. And if I can't help you over the phone, I can help connect you with a local doctor or pharmacy or hospital as needed. These conveniences aren't available in most other medical practices, and we've seen that they've really helped reduce visits to the ER and urgent care centers. Now, the cornerstone of this new practice is the extensive annual wellness assessment with advanced screenings and diagnostics to really help determine your risk for disease, specifically things like heart disease, which in women claims more lives each year than breast cancer and lung cancer combined. The screenings and tests also assess your risk for many other problems like diabetes and blood pressure, all the chronic issues we desperately want people to avoid. And if you're currently having a problem with those, we'll address those needs also. We'll also use a body composition device which can help determine your basic metabolic rate and things like percent body fat and visceral fat. This will guide us in designing a custom workout routine for you as well as a customized nutrition plan. In addition, you get access to my complete weight loss program online, and that's a $1,700 value in and of itself. There is a yearly fee for the comprehensive MDVIP Women's Health Program, and that's $2,250. Now, quite honestly, that breaks down into just about $6 a day. I think your health is worth that kind of investment. This fee can be paid quarterly, semi-annually, or annually. And I actually now have a few spots left, and then I'm going to start a waiting list. I just recommend trying it for at least a year. Over 90% of members in MDVIP affiliated practices renew year after year. Now, I gathered some frequently asked questions after talking to a lot of patients about this and having done this for about a year now. So I wanted to provide those questions and answers to you just to give you some more information to help you see if we can meet your needs. Number one, will I need to see a separate primary care physician? Well, that really depends on your current individual medical situation. For many women, I can function like a primary care doctor. However, if you have pre-existing complex medical issues, we'll work closely with your specialists or internists and provide them with information from your screenings to enhance your total care. Now, we can handle routine primary care issues for you, but we'll work with each situation based on your needs and what is in your best interest. Number two, can I keep my specialists? Of course. The MDVIP program does not require the use of specific specialists or any certain panel of physicians. Your existing relationships can remain exactly the same. And I'll continue to refer my patients to any specialists that I feel are appropriate for your care. No limitations there at all. Number three, does the annual fee have to be paid all at once? Absolutely not. You can split the payment into quarterly and semi-annual installments, and the fee may be reimbursable with flexible spending accounts or health savings accounts, and you'd have to verify this with your own plan administrator. In addition, I'll offer a family plan, which means I can see your female dependents or children from 16 to 26 without them paying any additional fee. Number four, do I keep my medical insurance? Absolutely. I'll continue to accept the same commercial plans in Medicare, and I'll file with these plans for sick visits and follow-ups just as I do now. Now, of course, you'll still be responsible for any co-pays, any co-insurance or deductibles required by your plan, but really it's business as usual when it comes to insurance. What exactly does my $22.50 pay for? Great question, and I want to be very clear about the value that this brings to you. Number one, it gives you 24-hour, 7-day-a-week availability to me directly by phone, text, or email. How do you put a price on that? You get a 2.5-hour one-on-one annual wellness exam that includes 11 different screening tests, hearing, vision, an extensive blood panel, much more extensive than most primary cares draw, vaginal sonogram when appropriate, and an hour session then one-on-one with me to follow up to review all your findings and really design an individualized plan for you achieving your best health now and in the future. You get a multi-page summary of your individual plan with granular details on implementation and many additional resources to make this a reality. You get unlimited access to our health coach who's on our staff for guidance, motivation, accountability regarding any health need, including but not limited to things like nutrition, exercise, stress management, and all that's included in your fee. You get a personalized MDVIP online patient portal with access to all your information as well as extensive resources on nutrition, exercises, over 700 recipes, curated health articles, and even see your appointment times. You get full access to the Women's Wellness Weight Management website containing extensive videos and PDF files on anything and everything related to weight management. You get guaranteed same-day or next-day appointments for any urgent issues. There's no wait times and on-time appointments. How valuable is that? If your appointment is at 2 o'clock, you're going to be seen at 2 o'clock. You get a minimal 30-minute appointment times for any issue and absolutely longer by any need or request. I have a private Facebook page just for our MDVIP members where I post medical updates, live presentations. We do question and answer sessions. Importantly, you get 32 years of practical, reliable medical experience in dealing with medical issues specifically geared towards the unique needs of women. You get access to MDVIP's Center of Excellence program for second opinions or specialized care if that need ever arises. You get travel protection from the MDVIP network such that if you get ill and you're in another city where an MDVIP practice is, and we actually have around 1,100 practices throughout the country, you'd have immediate access to their physicians, avoiding having to go to a strange ER or a strange hospital. You get monthly emails discussing current health issues like COVID, heart disease prevention, and hormones. It's simple to join. Just go to www.mdvip.com/Ron Eaker MD. That's RONEAKER MD. Or call 866-386-6863. That's 866-386-6863. Also, if you have any additional questions or just want to talk to me personally and ask me specific questions about your needs, feel free to call 706-842-4210 and we can talk one-on-one about your particular needs and how we can best serve you in your health care going forward. I hope to hear from you soon. Thanks for taking the time to listen today.